Friends and colleagues, readers of the British Journal of Social Work, I'd like to welcome you to our first, actually the inaugural, as it is, Editor's Choice video podcast. My name is Professor Vasilios Loakimidis, and alongside Dr. Ray Maglailic, I co-edit the British Journal of Social Work. Now, the Editor's Choice section of the journal has existed for a few years now. It has allowed the opportunity for readers to enjoy free access to a number of really important research studies selected by the editorial team. Now, these papers over the years have showcased the breadth of scope and the coverage of the British Journal of Social Work and its contribution to the broader social work community, the community of practitioners and the community of academics. Now, actually, what we decided in our editorial team is that from the current issue on, our editorial team will introduce a series of short interviews with lead authors of selected papers in order to give the opportunity actually to academics and research teams to speak more about the research to a wider audience. Now, the current issue, the issue 6, volume 50, actually it was published in September 2020, has been a particularly interesting one. It has focused on a wide range of themes, including social justice related topics, ethical dilemmas, current debates on child protection. And actually in this issue, our editorial team felt that one specific article stood out as the most impactful one due to its methodological innovation and actually relevance to some really important debates. Now, the title of the paper, actually the title is a bit wordy, From Snapshots to Practice to a Movie, Researching Long-Term Social Work and Child Protection by Getting as Close as Possible to Practice and Organizational Life. So we're privileged today to have with us the lead author of this paper, Professor Harry Ferguson. Harry joined the University of Birmingham in 2017 as a professor of social work, and he took up his first lectureship in 1990 and has held professorial posts since 2000. He has taught and researched widely in the areas of social work, child protection, domestic abuse, fatherhood, masculinities, and men's life, as well as ethnography and mobile research methods. And as I said, we're privileged to be here with Harry and have the opportunity to discuss about this important research. So Harry, welcome.
Thank you.
My first question would be about really introducing the research team, because I understand that this has been a collective effort, and perhaps tell us a bit more about the overall research aim and the motivation behind this research study.
Yeah. Well, firstly, Vasilios, it's a great pleasure for me to have this opportunity to engage with you and to, for the paper to be the editor's choice from this issue. I love the British Journal of Social Work, always have since I came into social work over 40 years ago. And I've been lucky enough to be published in it a few times since I became an academic 30 years ago. So yeah, thanks ever so much for this opportunity to engage in this way, this really novel way. So I'm sat home here in my bedroom, like we all are during this pandemic, most of the time. So yeah, this paper came out of a project that happened between 2016 and 2018. It's a 2-year project that was funded by the Economic and Social Research Council. And the research team consisted of 6 of us. So I was the principal investigator, and there were 3 other social work academics, Jadwiga Lee, who had an interest in it, who'd done ethnographic research prior to this, Liz Badeau, based in Jadwiga was in the University of Sheffield, and she's since moved on to Lancaster University. Liz Bedeau from the University of Auckland in New Zealand, who's got an international profile around supervision in social work. My colleague at the University of Birmingham, Tassem Singh Kuner, whose expertise lies in the whole area of digital kind of social science, and that linked to the project in terms of how we looked at how social workers use social media, and some of the outputs from the project have involved producing apps, which I can say more about later. And the two research fellows on the project were Lisa Warwick, who done her PhD with the ethnography of a children's residential care home. And Lisa is now a lecturer in social work at the University of Nottingham. And the other research fellow is Tom Disney, who's a human geographer and now has a post at the University of Northumbria. So I was, in sort of bringing the research team together, I was really interested in getting a bit of at least some cross-disciplinary component. And, human geographers are doing lots of interesting work. And Tom had actually done an ethnographic study of orphanages in Russia. So so his expertise fitted in superbly with the project. So do you want me to go on and say more about?
Really, Henry, this paper, as I said before, it stands out as a very important paper because of the methodological innovation it introduces. I mean, ethnography, of course, is not is new in social work, but long-term observation and long-term ethnographical studies are rare in social work. So would you like to elaborate on the specific methodology and how you designed the study?
Sure. Well, going back over my 30 years in social work, I'm not going to go through each year one by one. I can reassure you about that, Vasilios. But the first 20 years, I can now talk in decades. The first 20 years, I've always been a qualitative researcher primarily, and the first 20 years, I, kind of satisfied myself with, basically doing. I've always been interested in, what is social work? Like, what do social workers do? And how do service users and carers, experts by experience, experience social work? And the sort of primary methods I was using for the first 2 decades were kind of do interviews with practitioners, like children and families, because my kind of primary area of interest has always been around child protection, social work with children and families. Do some focus groups, that sort of thing. I've also done kind of some quantitative methods, but I get other people to do that for me because I don't have those areas of expertise. So about 10 years ago, I sort of became really conscious of the fact that, I began to wonder why hasn't social work got closer to practice? Why is it that? Why not? So I became aware of the fact that why don't I go and observe what social workers actually do? So I started to read more around ethnography, and the sort of things that were being said in the social work literature was it would be too ethically complex to have a researcher present during such sensitive, consequential encounters as social workers going to check on the welfare and safety of children and so on. But I was really lucky to be able to work with a social work team who helped me to develop a sort of a protocol, if you like, for observing practice. I did some observations of social workers, primarily going on home visits. So I started to go out with them in the car and interview them on the way there, observe and audio record the encounters between them and the children and the families. I'd interview them then on the way back to the office. I'd do a bit of observation in the office. So at the same time, I was getting interested in sort of the whole sociology of mobilities and movements, and there was a lot being written about the car, and you know, and there was some interest in the home in social science as well. So I was kind of trying to draw in this sort of whole kind of theoretical and sort of practice turn, as it's sometimes called within sociology, you know, kind of a stronger interest on practice and getting close to everyday life. So ethnography, that's what it's fundamentally about, isn't it? It's about observing naturally occurring events. Yeah, so the naturally occurring events that I became interested in observing were the encounters between practitioners and children and families. So I was lucky enough to get an ESRC grant to do a study that was around 2012, 2013, and that was a 12-month study. And most of the 87 observations I did on my own in that study were of home visits, and they were mostly kind of just one-off observations in cases. Although sometimes social workers would tell me about, you know, the work that they've been doing over a longer period of time. So, so after I completed that, I began to think about, well, you know, I feel like I've got a grasp of like what happens on these snapshots in casework, if you like. Now we need to watch them. Now we need to see what happens in the movie. So I mean, that's the title of the paper, you know, from snapshots of practice to a movie. And that's a quote that I took from a book by Bren Neal, who's written a lot on qualitative longitudinal methods. So I became curious about, well, what, you know, and in fact, the core research question for the study was, you know, how do social workers begin, develop, and sustain relationships with children and families over time or not? And the second key research question was, and you know, what is the influence in this of organization, staff support, and supervision? So this led on to an ESRC application to the Economic and Social Research Council to do a 2-year study which examined those 2 research questions, using ethnography, observing practice as it goes on, wherever it goes on, in the home or in the office, in schools, and also this time putting more attention as well on what was happening in the social work organizations. And we deliberately chose 2 different, we based the study in 2 sites, and they were different in terms of office design. So one of them was a hot desking organization where, you know, social workers didn't have their own desks. And the other one was a more conventional, traditional office design where they did have their own desks. And in fact, they were based in sort of small team offices. So, you know, that was to kind of connect the study into, you know, issues and debates that were arising then and still are around the influence of, you know, whether you've got your own desk, so on.
Exactly. And what was the duration of the study, of the observation?
Right.
And also, you already touched on this before, but I'd like to hear a bit more about the, I suspect, inevitable ethical dilemmas that are embedded really into this type of research. And so I'd like to hear more about the duration and the technical aspects of designing ethnographic studies. For example, how do you get access to participants? Aren't the organizations defensive? As we know, that's one of the main problems, especially very often in social work organizations. Gatekeepers are defensive. So how did you deal with these, and what kind of ethical dilemmas emerged?
Yeah, well, it was a 2-year study in terms of like the funding, and the field work lasted for 15 months. So you're absolutely right, Vasilios. The first challenge is to get organizations to let you in. And, you know, we have a paper that is published in Qualitative Social Work from the project which Jadwiga Lee led on, which is about some of the complexities and dynamics of trying that, you know, once you get from, so the starting point is to get permission, access from senior managers. Then the next challenge is to get it from the people at the front line, you know, the people, the practitioners and the managers who you're kind of going to be observing. Yeah, so, you know, there's some interesting findings around the whole process and complexity of gaining access that are in that paper that Jadwiga's led on. You know, it takes a huge amount of goodwill and courage for practitioners to let you in and observe their practice. And to allow you to do that for 15 months is a huge commitment. And, you know, we were really lucky to have, you know, tremendous cooperation and goodwill from so many practitioners and managers. Now, that doesn't mean that it was all plain sailing, because it never is. And there, you know, I suppose to cut to one of the kind of findings really around this, I think it's, you know, one of the things I've become more aware of through doing this research is that, you know, one of the reasons why it hasn't been a very commonly used methodology in the past is because there's been an assumption that you won't get access, you won't get consent to do this. So I don't think that's true. And I think this is going to become a more sort of acknowledged mainstream sort of methodology as we move forward. And one of the things that, you know, I have found over the years is that, you know, you have people like social workers with different outlooks at the beginning. So you can have some who don't want anything to do with it. You can have some who are really into it, and then you can have some in the middle who are sort of ambivalent and they're sort of interested, but they're not sure. But what happens over time is that people who are initially quite anxious, sometimes really anxious about being observed, they start to find it quite useful. You know, we've had a lot of feedback, and in the paper, in the journal that we're talking about today, from Snapshots to a movie, you know, we quote from some practitioners who talked about how useful they found it to be observed. And you know, the methodology is one in this project is the same as the one I briefly alluded to that I did in the first ethnography I did, where, you know, you're shadowing social workers in the office, you're going out with them, usually in their car, you're spending time with them, traveling to see their families, you're talking to them on the way back. So you're, you know, as a researcher, you're asking them to think and to reflect. And so they generally feedback that they find that useful. And if, you know, if it's an observation of a case conference, then similarly in the office, you know, these or whatever, there's constant dialogue going on about the work.
So at the beginning, in initial stages of the research, there must have been some degree of uneasiness, and then eventually practitioners felt more confident and more comfortable with the process.
Absolutely. Yeah, I mean, there is a process that you go through when you enter the field and become much more kind of acculturated, if you like, assimilated. And, you know, ethnographers have written a lot about this, where the problem then becomes where you're in danger of going native, in the sense of, you know, losing your objectivity. So, you know, after a few months, you know, we sort of became absorbed into the working routines of, you know, we weren't noticed. well, we were noticed, but especially when you carry around one of these, they're like, this is my kind of, I've done so many recordings on this machine. I love it. And even the back of it, look, it's sort of broken, but I'm not going to let it go. And I'm constantly, holding onto the batteries to make sure it works. But one of the standard jokes often is, oh, here they come with their recorders. And so there's an issue about whether these are on or not a lot of the time too, and what people are willing to say when you turn the machine on. But yeah, and like on both the sites, there'd be like humor used. They were often offering to give us cases, give us a caseload and things like that. But in terms of the ethical issues you were, alluding to, Vasilios, I think one of the most interesting issues here that arose really was, when we set off with this research, we didn't even know if it was possible to sustain it. Because, what the research design involved was spending the first 3 months identifying a sample of cases of 30 cases that we then shadowed for up to 12 months. So there were 15 on each site. And, some of those were on child protection plans. So we knew that they would last for quite a while. That's what the social workers told us. But beyond that, we didn't know how long they would last. And we didn't know how tolerable it would be to have us hanging around. Actually, so it was with huge relief that we got to the end. So we wanted to follow them for 12 months, for the whole 12, for as long as they were open for 12 months. And from memory, I think it was something like a dozen of them were open for 12 months. And the shortest amount of time any of them were open for was 5 months. And in that time, the smallest number of observations of practice we did was 10, and the most was 21 in each case. I mean, so, with one family, we observed the practice on 21 separate occasions. And as I say, the lowest was 10. So anywhere between 10 and 21 observations, and you're going out with the social workers, or you're in the case conference when the family come in or whatever, one of the most interesting things was, well, what does that mean for us in terms of, like, have we become part of the case, in effect? And ethically, what does that mean? So the paper in the journal does, have quite a bit to say about those dilemmas. My own view is that, there's a bit of a debate within social science about the amount of effect that an observer has, the researcher has in ethnographic work. But obviously you have some, you can't have there can't be no impact of you being there observing.
You already mentioned that there was a degree of inevitably trust building and relationship building with the practitioners, which would be absolutely natural over a number of months. And you also mentioned the risk of going native and being absorbed in the process. How easy was the ending of the process, the closure? Because you've, over a number of months, you develop close relationships inevitably. You try to stay neutral, but you're part of the process. So uneasiness turns to trust. And then what happens towards the end? How did you handle this?
Well, yeah, I'm really glad you asked me that, because, one of the things that happens when you become more trusted and accepted within the sites is that people reveal more to you. And so I think the depth and the richness of the data definitely, increased, improved, as it were, the longer we were there. And, you know, we found out more about the emotional effect, for instance, of the work on practitioners. You know, we interviewed families on three. That was another aspect that which I haven't mentioned actually, was it also incorporated interviewing parents, or at least one parent from each of these 30 cases, at least once and ideally 3 times. So so we also developed sort of relationships with the parents to an extent, but it's a very peculiar kind of relationship, because the kind of ethnographic practice that, you know, I think is really important is where, you know, in terms of, you know, ethnographers talk about participant observation, and the sort of the choices you have really are around how much do you participate and how much of it is about just observation, right? So there are some ethnographers and anthropologists, like one of my favorites is Daniel Miller from the University College London. He's a fantastic ethnographer. And he argues that ethnographers should be really helpful and get stuck into the communities, like get involved and do volunteering, you know, going into these villages or towns or wherever they are in the world, and they can be in the UK. I mean, he's recently done an ethnography in Ireland, for instance. So at one extreme, you have that argument that, you know, it's about participation. It's about observing through participation, if you like. Whereas I'd be at the other end of the continuum. I think we were and are as a research team, where the emphasis is on observation and participating as little as possible. Because, you know, one thing I'm really clear about is that, you know, this is about ethnography as observing naturally occurring events. We're trying to find out what social workers do. We're trying to find out what families experience. So the least impact we have on those encounters, the more we can be convinced or confident we can be that that's what would have happened if we weren't there. Yeah. So so I think we did definitely influence practice in some respects, and I, you know, I think my own view has kind of shifted from what I've learned in this project, where on the one hand, you know, ethically, I think it's really important, you know, for people who are interested in doing this kind of research going forward, it's really important to convince ethics committees when you're applying for ethical approval that you will do everything in your power to minimize having any impact on these encounters, because it's about, you know, protecting children and so on. Right, so the ethics application has to include all kinds of commitments to, you know, withdraw immediately if you get any sense that your involvement is negatively or adversely or in any way influencing, you know, the protection work, the task, the social worker's task. So that's a really important aspect of what you need to do to convince ethics committees. But on the other hand, I think what we need to be saying, or what I've learned, is that, you know, actually, you know, it's okay to be helpful as well. You know, it's okay to, you know, why not? You know, why shouldn't we be helpful as researchers? And there's been a couple of other social work academics I'm aware of, Gillian Rouge and Donald Forrester, who've made similar arguments from recent research, that it's not just about making the case for doing no harm, it's also about making the case for social work research actually doing good.
Right, so in a sense then, neutrality is important, but in a context, you know, with in a complex context like this, organizationally and practice related, inevitably there will be some impact, just summarizing. And if the impact is negative or potentially harmful, your advice to researchers, of course, is that you immediately withdraw. But if it's positive, that's fine. It's fine to generate positive impact to participants. That's a very interesting observation, because it goes back to traditional debate, as you mentioned already, about the neutrality of the researcher. So this is great advice, I think, to early career researchers or other researchers who might be engaging with similar type of research.
Yeah.
And can I ask you, Harry, how, in your opinion, what can practitioners learn from this study? How is this research relevant to social work practice as well?
Hopefully a lot. I've just stopped myself from saying, you know, I'm quite proud of this research, but I didn't stop myself in the end. That's what the hesitation was about there. You know, I'm really proud of our research team, because we got there in the end. We got through this tricky piece of research, and you know, I'm even prouder of social work as a profession. You know, and that's the important thing here. It's because, you know, getting close to practice like this, you know, I think it's so important, because you know, I think it's a really, I think participant being there, you know, it's not without its methodological issues. You know, there's still acts of interpretation to be done about what you're observing. So it's not a kind of a pure, transparent sort of reproduction of what the truth and reality is in that sense. But, you know, being there really helps you to convey, you know, what the work involves, what, you know, what gets said, you know, like, so it's helpful to practice, I hope, you know, in a whole variety of ways. Like, you know, we've been able to show like how relationships have been sustained over time. And there's a paper has recently come out in the journal Social Work Education, where we conceptualize the notion of a holding relationship, in terms of, you know, relationships where, you know, because we were able to go back with the workers like every week, every month, you know, up to 21 times, you know, we're able to show like what the workers said, what they did, where they sat, you know, what the, you know, convey the atmosphere that was in the home when they visited. You know, I'm intrigued by atmospheres and what, you know, and how workers sort of contribute to those atmospheres and diffuse them. You know, we're able to show how they work directly with children, and sometimes how they did not work directly with children. So we have another paper that's recently come out in the journal Social Work, the Journal of Social Work Practice, which is about what we call hostile relationships and working with so-called involuntary service users. So what we were able to do in that paper is show, you know, we examine in detail a sort of subsample of cases where the families definitely did not want social work involvement, and just, you know, I think we've been able to evoke in that paper the sort of hostility, the conflict, the anger, the anxiety that this caused both for parents and workers, the hate actually that was at the heart of these relationships. You know, and, you know, one of the big challenges for social work is how do you maintain a commitment to the values of profession in terms of compassion, being non-judgmental, when people are telling you to get lost all the time? How do you not retaliate? You know, and so hopefully that kind of, you know, output can help the profession to think about those really important things. So I think in essence, Vasilios, what we were trying to do is, you know, we know that relationships are key, but I suppose one of the kind of the next question we need to answer is, well, what kind of relationships? And by observing them, you know, and trying to conceptualize from that, hopefully we're making some kind of contribution to understandings of practice.
Exactly. And You already mentioned how this paper is part of a bigger project, and I know that, and you already mentioned that you're working on different research studies and eventually articles, and given that this is a really important research social work, and I know that recently there was an article also in the Guardian. I think it was very impactful, very important. It helps really disseminate findings to a wider audience, and at the same time generate really important debate. So well done. That was very important as well. So
Thank you.
what are your future plans then in terms of following up this study?
Well, I'm personally, I mean, the research team has gone in different directions in terms of their own interests and so on, and we've been putting a lot of effort into producing outputs from this study. My colleague Tassem Singh-Kuna, for instance, has developed some really interesting 360-degree films. What we did was, or what Tassem did was, based on the findings, we developed some scenes that could be reenacted, and we got actors to do that who were actually service users, part of our service user and carers group at the university. And so Tassem went along as and did the recordings of those, and they're available on apps. So again, in terms of impact, we're still kind of trying to mine the data, if you like, to develop resources for practitioners for the system, to promote learning. In terms of some of my own work, I did have some plans to sort of take the methodology further in other areas of social work, but then the pandemic happened, and so over the last, what date is it? We're in December now, aren't we? Yeah, this is the 17th of December, 2020, and so for the last 8-9 months, we've been tied up with COVID-19, and I was lucky enough to get a grant from the Economic and Social Research Council to do a study of the impact of COVID-19 on social work and child protection. And so sadly and not surprisingly, I haven't been able to, do what we call the sensory ethnography, where we actually are there in the in the offices and in the home, but because of social distancing, hasn't been possible to do those observations. But I've migrated to digital ethnography now, and luckily enough, Sarah Pink, who has written a book on digital ethnography, who's a great anthropologist at the University of Melbourne, is on the research team along with Laura Kelly. And so again, the study it's longitudinal. We've been interviewing social workers since April. So we're just finishing the data collection tomorrow, actually, and we've interviewed up to 47 social workers up to 7 times about their experience of social distancing and trying to, work effectively with children and families during this awful pandemic. But yeah, just generally in terms of the future, I'm, really excited and interested in taking this methodology forward, and I'm relieved that it seems to work. One thing in terms of all the ethical dilemmas, one thing I think we did conclude, and this sounds a bit self-justificatory, but we did conclude that it didn't seem to do any harm, or we weren't told about any particular harm that it's having us there for all this time, all that time, 15 months, tracking cases for 12 months and so on. We weren't made aware of any harms that it caused. So what excites me is its scope to inform practice, possibly to do some good, while you're there. And you know, and I would like to take it into other areas of social work, you know, with in mental health, social work with older people and so on.
It's very interesting that when discussing about the research aims and the motivation, you really asked and you try to address and tackle some of the most fundamental questions in social work. Like, what is social work? It appears to be a simple question, but it's the most complex and fundamental questions of all, as researchers know. And how does social work practice look like in specific settings? And you've just explained in the clearest way possible how and why ethnography is one of the most suitable ways in researching those fundamental questions in social work. So Harry, thank you so much. Really enjoyed the discussion. Thank you for actually joining the inaugural interview, really, and there will be many more in the future, and hopefully we'll be able to talk about your COVID-19 research in the future. And once again, it's been a privilege speaking with you.
The privilege is mine. It's been a great, yeah, I feel really privileged. That is the word, to have this opportunity. And, you know, like any researcher, it's lovely to talk about our research and for there to be an audience for it. And yeah, so, you know, I'm really grateful to the research team as well and for everything they've done. And yeah, and thanks ever so much for this opportunity, Vasilios, and for being, you know, such an enabling interviewer as well. I've really enjoyed it. Thank you.
Excellent. Thank you very much.